Everyone, this is Dr. David, physical therapist with Paso Manual Physical Therapy. I'm answering a question that I got from a client today. They asked, when should I seek some expert help if I'm dealing with some pain that's actually getting better? So let me give you a little bit of backstory. This person does CrossFit and they've been doing it for a while. They started getting some knee pain during squatting. So I asked him, has this happened before? And he said, nope, never had any knee pain during squatting. Then I asked, have you changed anything in your routine? Like, did you start to increase the weight significantly more or do a lot more reps or work the intensity up? His response was that he hadn't changed anything in his normal routine. He's been up to the same workouts as planned. Next, I asked him two more questions. Have you squatted since then, and does it continue to hurt? And his response was, yes, he's squatted light, and it feels better, still hurts, but is getting better. So now I was ready to answer his question of, do you need expert help? And the answer is no. At this point, if you're getting better, as long as this doesn't last for more than a week or two, it should continue to get better. But he still wanted to know, why did this happen? What's going on? And so here's the explanation. There's a difference between being injured and being irritated. Let me give you an example. The best thing to think of is if I were to scratch my skin right here, I'd get a red line. That's irritation. As long as it wasn't a big scratch, you might see a red line that lasts for an hour, maybe a few hours. It'll be gone by tomorrow. No big deal. But let's say that I scratched myself so hard, I cut my skin, a little bit of blood came out. Now I've got to go through the healing process. Now, chances are you've all dealt with a skin cut, and what happens is it scabs over and you give it some time, usually a week or two, depending on how big it is. But here's the interesting thing. Skin heals super fast. It's on the outside of the body, so we need to be closed up as soon as possible. Now, this guy that I was talking to, I didn't get to check him out, but I suspect it was the cartilage in his knee. That heals really slow. So it's possible to have irritated cartilage, not injured, but irritated cartilage. Remember, think the red scratch. So I think this guy had irritated cartilage in his knee, not injured cartilage, and it's going to go away on its own. It's just going to take a while. How he irritated his knee, it's hard to say. He might have just had some poor form issues that day, or it might have been the workout that he was doing. Hard to say. What I did tell him is, as long as this is not becoming a regular thing, him irritating his knees when squatting, then it's nothing to worry about. So here's the takeaway point for you. If you've irritated some body part like your knee, your back, or shoulder, and it's not becoming a regular thing, just give it some time. Some of the tissues on the inside of your body, like ligaments, tendons, cartilage, they just take a little longer to recover from. Now, if this guy had been telling me that his knee had been hurting off and on for months, maybe a year, the answer would be different. There's obviously some problem that has not resolved itself. There's some form issue, some technique issue. There's something that needs to be fixed. And it doesn't mean that he needs to start treatment with somebody like me. We just need to make sure that we pinpoint what's going on so we can give him direction on where to go next. Thanks for tuning in, guys. This is Dr. David with Paso Manual Physical Therapy. Have a wonderful day.